This is setting a pump to help people setting a pump at any time. So to start off with, we're going to actually put the batteries inside the pump. So you need to make sure that you have new batteries with a full charge. Try to keep your ribbon outside of the pump and place the batteries inside the ribbon. This helps with actually, if you need to replace the batteries at any time, you just pull the ribbon to get them out. Make sure your back cover is in securely and it clicks in. They can be a bit temperamental. And then if you turn your pump around, it will tell you, that's fine, it will go through its settings, and when it's happy to be manipulated, it will beep a few times to tell us it's happy to be used. If you have to set a pump at any time, start at the very beginning. Every pump has to be in lock level 0 for you to be able to manipulate the settings. So if you go to lock level, press once, it's in lock level 1. It has to be in 0, so you press the down arrow and enter. The pump will ask you for a code, so you have to go up to 65. I usually go well above it. Always press enter to save the value. It's now in stopped mode. So if you go into your settings, you will be able to change some of your settings, but not all of them. So the reservoir volume on here is 43.8. What we want is for the volume for a 50ml cassette to read 45. So we need to go up to 45 and enter. If you have a 100ml cassette, you would want your value at 95 or whatever the patient's prescription states, because then obviously it will save the program. This will give your patient a buffer time of the alarm going off as to when they actually need to go and change their cassette. So we go to next again. It says continuous rate is 3.2. Depending on your prescription, you may need to go up or down, whichever is appropriate. So we'll put it to 3. Always remember to enter to save your value. You go to next again. It says it's given nil, so we need to press nil, yeah, and enter again. So that should be correct. This is just telling you what the pump has actually given. So if you need to swipe it ready for the next use, always press enter to swipe it to get rid of that reading. Press next again. The air detector on here is high, so the air detector is this part of the pump, and it should always be on high for our patients. So that's correct. Next again. This one says upstream sensor is on, which we will need to change to off, and we can do that in the biometric settings, which we'll go through in a minute. It doesn't mean anything dangerous to the patient. It just means that the function to use this part of the pump for a drip is actually active and we don't use it, so we can turn it off. It's not the end of the world if it's left on. Press next again and we're back in stopped mode. So now I want to go to lock twice and enter 165 or 165, and this will take us into our biometric settings. So one bit more. Oh, way too high as usual. Come back down. And enter. So now you can see the reading says air detector is on high, and that's fine. You can move this as per your need, but we know that for our patients on Velitri, this should always read high. So always remember to enter if you have changed it to keep your setting. The upstream sensor, as we said earlier, is on and we need to switch it off. So we're going to go to the down arrow to switch it off and push enter, and that will now save our value. Going to next again, it's on a continuous delivery mode, which is absolutely critical. This is the one you must make sure is not reading intermittent, which is its other choice. So you need to make absolutely sure it does say continuous and press enter if you've changed it. Press next again and the pump will ask you, are you happy with these settings or do you want to go back around the circuit again to change anything? I'm happy, but if you want to, you can go back through your settings, pushing the next button to see what you've done and to make sure that you're happy and you don't want to change anything else. When you are happy, if you push enter, the menu will take you back to the stopped mode. Remembering that now our program should be set, what we want to do is go back and check what our settings are reading. So if we go to next now, it's saying reservoir volume of 1. Okay, these are our ceiling rates, continuous rate, mils an hour. It hasn't kept it. So what we need to do now is to go back into reservoir volume, and we're going up to 45 as we did in the beginning. And press enter. So then our next one is, it says reservoir volume 46, should be 45, enter. So next, continuous rate 0. So obviously we're going to need it as per our prescription. We'll go to 3, wasn't it, I think. And enter. Then we're going to push next again. It says given none, that's right, because we haven't had it attached to a patient. It says air detector on high, which is also correct. And the upstream sensor is now off. So going back to next again, it's now on stopped. So what you want to do is to lock that program to make sure that we can't make any mistakes and the patient can't inadvertently change the settings. So if you press lock and then go to 1 and enter, the pump will ask you for a code again and you need to go to 65. And enter. So now we've got it back into stop mode. Our pump should be locked. If we push lock mode, it should tell us it's in lock level 1, which is safe for the patient to go home on. But just remember, if you did need to make any adjustments to the pump settings, you can't do that when it's in lock level 1. So now if we want to check our settings, we go back to stopped. It's in 45 mils for our reservoir volume, which is what we programmed in. It's saying continuous rate of 3 mils an hour, which is also what we programmed. It's not given anything yet, so there's no numbers there. The air detector is on high, which is correct. The upstream sensor is now off, which is also correct. And we're now back to stopped. So now if we're happy with our settings, you're going to turn the pump off. And just keep your hand on it, your 3 dashes come, and then the display goes blank, and that's your settings finished.